My LSH procedure had very little scarring. The time in the hospital was 24 hours. The time at home was 3 days.
The recovery was phenomenal. I think I started working from home the next day. I certainly was on my computer and on the phone taking care of work.
This is so fast. This is so uncomplicated. This is so easy. And you return to your normal level of activity so quickly. There is absolutely no reason to put this off.
I mean, it's really no comparison to the two. A hysterectomy is a thing of the past. The LSH is a thing of the future.
For each of these women, the decision to have a hysterectomy was not an easy one. After all, a hysterectomy is major surgery and can affect a woman emotionally as well as physically. Although hysterectomy is the second most commonly performed surgery on women, for many it conjures up thoughts of long recoveries and significant scarring. However, as these women discovered, new procedures now offer women a less invasive alternative with minimal scarring. A hysterectomy is the surgical removal of the uterus or womb. Nearly 1 in 4 women will require a hysterectomy by age 60, and over 600,000 hysterectomies are performed annually in the United States. There are 3 basic types of hysterectomy. Supracervical hysterectomy, when the uterus is removed but the cervix is left in place. Total hysterectomy, when the uterus and cervix are removed. And radical hysterectomy, when the uterus, cervix, and some of the pelvic lymph nodes are removed. Oftentimes the ovaries and fallopian tubes may be removed as well.
The doctor recommended to me that I should have a hysterectomy, which I felt like the end of the world had happened to me because I'd heard so many horror stories about having a hysterectomy and also the end result, 6 to 8 weeks of laying around the house and the uncomfortable feelings you have. And then also the feeling afterwards, they say, wasn't the same.
He said I would not only need a conventional hysterectomy, but he would have to cut me from my umbilicus down to my pelvic bone because of the size of the fibroid. He said there was absolutely no other way to get it out, at which point I left his office.
A hysterectomy may be recommended for one or more of the following reasons. Fibroids, which are growths inside the uterus. Menorrhagia, which is excessive menstrual bleeding. Endometriosis, which occurs when tissue that is normally in the uterus appears in other parts of the abdomen. Or pelvic support problems, such as when the uterus falls from its normal position. Hysterectomy is also indicated for treating some cancers of the uterus and cervix.
Years ago, I had an episode where I had problems urinating, and I went to my gynecologist who said that it looked like I had some uterine fibroids. And at that time he said, let's watch it, but ultimately you'll need a hysterectomy.
I was getting heavy periods closer together at that point. And that was bothersome more than uncomfortable. So I knew in the back of my head I was probably looking at a hysterectomy, but like most other women, trying to put it off as long as possible. And frankly, I was not really interested in going through the recovery period involved in a hysterectomy.
I had fibroid tumors, and what happened is that I had a continuous menstrual that wouldn't stop. So I had different types of medications that I took, but I had got a referral to a doctor, and this doctor, I explained to him my situation, and he suggested the surgery.
It used to be that total abdominal hysterectomy, the removal of the uterus and cervix through a large abdominal incision, was the only type of hysterectomy offered to women. For many women, this procedure is what first comes to mind when hysterectomy is suggested by their physician. The total abdominal hysterectomy is the most invasive option and requires a 4 to 6 inch incision across the abdomen, resulting in a visible scar. The surgery requires an average hospital stay of up to 3 days, and the recovery period can be up to 6 weeks. For some women and for specific conditions, this is still the right choice. Vaginal hysterectomy is a procedure that removes the uterus and cervix through an incision inside the vagina. A vaginal hysterectomy usually results in less postoperative discomfort, a 1 to 3 day hospital stay, a 4-week recovery time, and no visible scarring. Laparoscopically assisted vaginal hysterectomy is similar to a vaginal hysterectomy, but also includes the use of a laparoscope, a thin lighted telescope through a small incision. The laparoscope allows the upper abdomen to be carefully inspected during surgery and allows the surgeon to perform part of the surgery through tiny incisions. Hospital stay and recovery time are similar to simple vaginal hysterectomy.
The average patient that we had would stay in the hospital 3 to 4 days post-surgery. Most of them were not ambulating particularly well when they went home. They would be off work for a minimum of 6 weeks. They were very restricted in their activity level. After the hysterectomy, they weren't allowed to lift, to walk a great deal. They were pretty much housebound. And that was an option that I did not wish to have for myself, so that's when I went looking for an alternative.
They made me feel like, you're 50, so a scar is okay. You're 50, you had your turn, and you got to realize, no, it's not okay. So I'm 50, I don't want a scar, so maybe I want to wear something sexy at 50. So why should I go through and have a long, ugly scar? The scarring was very important to me as a woman.
A recent, even less invasive and less traumatic procedure is called laparoscopic supracervical hysterectomy, or LSH. LSH uses laparoscopy alone to remove the uterus, but leaves the cervix intact. During the procedure, a laparoscope and small surgical instruments are inserted through tiny incisions in the navel and abdomen. Using these instruments, the surgeon is able to carefully separate the uterus from the cervix and then remove it through one of the incisions. Because less cutting and tissue manipulation is involved, there may be less chance for damage to other internal organs like the bladder. LSH is an innovative procedure developed to reduce pain, minimize scarring, and shorten recovery time. The procedure can be performed on an inpatient or outpatient basis under general or regional, spinal or epidural anesthesia, which means that you can be home resting comfortably within 24 hours and often the same day and back to your normal activities in less than a week with only tiny scars. In addition, LSH preserves the cervix, which some research suggests may help to reduce the risk of some complications associated with total hysterectomies.
The most surprising part about going through this procedure for me was waking up after the anesthesia wore off and feeling fine, and feeling that there was no huge lump in my stomach and that there was no pain from the procedure. There was no pain from the incisions, the tiny, tiny incisions. It was just kind of magical. It was just done.
I came home, went to bed, got up the next morning, and I got out of bed and I remember thinking, I feel normal, and thinking how odd that was, how normal I felt. And I kept going, all right, system check. There's got to be something that's aching. I have to feel bad some way. I just had something done to me yesterday. And I had none of it, absolutely none.
And it was like unbelievable for me to have that surgery. And 3 days later, sitting in a restaurant, oh, I was happy. I was happy to see about a scar this big on my stomach. So I'm very happy with the surgery.
I would have been off work for almost 3 months from the procedure that I was going to receive, but thank the Lord it didn't work out that way. But some people are narrow-minded, and it's only one way, this way. They're scared to look on the sides. So if they don't look on the sides, they'll end up having to go through all of this for nothing because it's so easy the LSH way.
To qualify for LSH surgery, you must have had a recent normal pap smear, commit to continue regular pap smears, and be free of uterine cancer. All medical procedures present risks. Talk to your doctor to see if LSH is right for you. Remember, hysterectomy is usually an elective procedure, not an emergency. Give yourself some time to thoroughly understand your options and speak with your doctor. If LSH is right for you, you'll benefit from the very latest procedure that will give you the shortest recovery time and the most minimal scarring possible.
We had another friend whose mom had a hysterectomy the exact same day that I did in another town. She had a conventional hysterectomy. I got a phone call from them 6 weeks later. We were going to meet at a football game, and they were calling to see if there was handicapped parking available because their mom was still not able to walk the distance from the parking lot to the football stadium. And by that point, I had almost forgotten that I'd had anything done.
Leaving the hospital that day, I was already saying to my family, why was I so stupid? What was wrong? Am I so stubborn? Am I really that stubborn? You know, what is wrong with me? I just wanted to kick myself because it was years of suffering that really was needless. It was just needless. I mean, I'm so grateful I did it at this point, but I just could kick myself.
Honestly, I have seen people with bigger scars from a paper cut.
I feel successful with it, and I think any woman who have this surgery, they'll feel the same way I do. They will share their story, they will show their scars, and they will make other women happy too. Because when I tell my story, women smile and go, wow. When I show my scars, they're like, you're kidding. And then I've met some women who go, look at mine. And it's like, ooh, but I don't do that to them. You know what I mean? I go like, oh, you didn't know about it. But if you don't know about something, that's what happened. That's why you should research any surgery that you have so you can know that you're getting the best for yourself.